straight and for the video instead of me doing that might actually be even more beneficial. Would anyone like to be the go out there and put yourself out? It's okay if you don't do it correctly. It's a good opportunity for us to give you feedback. No? Nobody's comfortable? You guys have been so eager for everything else. I thought for sure someone would just dive right out there to try it. Okay. I won't push you. I'll do it. Okay. So what we're going to do is we're going to have you go ahead and bend your knees up. And we're going to have her roll to her side. Okay. And I'm going to help her sitting up. What I'm going to do is I'm going to have my wide stance. Okay. The key concepts here: wide stance. I'm going to place my arm underneath on her body, never on the neck. 2 rules of moving patients: you never grab their neck and they never grab yours. Okay, very critical, because I will see people, you'll see this a lot in caregivers that have been moving patients. Oh yeah, I haven't put their arms around my neck. I'm just thinking, okay, but please don't do that. That's really, really risky for you, and it's a bad habit to get the patient into as well. But also, you don't want to grab their neck. So you're going to come in under this way and have your hand there. And then you can actually, if you feel like that's not supportive, you can actually support them a little bit, but you don't ever want to pull on the neck. Does that make sense? And then the other hand is going to come here on the legs, because you're going to cue them to bend their legs. And notice how my leg is here so that I can support her legs and keep them from just dropping straight down. Okay? And then once she starts to come up, I will move my hand up to her pelvis and tip her up like that. Does that make sense? Any questions about that?
Are they helping a lot, or are you mainly pulling?
It depends on their level. Go ahead and lay back down. I can. There you go. So if she's, don't help me. Okay, if she's pretty much needs a lot of assistance, so I'll bring her like this. I'll get here, and then I can just by tipping her like that and bring her up. She was helping a little bit more. It's hard to not help when you're able to do so. It's hard for your body to be totally dependent. But so you can, if you think about the leverage, if you've got her in that 90 degrees bent at your hip and you just tip her up, you're basically like a board, you're like a seesaw. If you push on one end, the other end comes up, because she's all attached. So if you think about this as her body lever, if you push on one end of it, the other end will come up, and so you're helping, you're kind of over the fulcrum of her hip, tipping her up. So that's why sidelining by yourself is, if they can get in that position, is a really nice, if they need a lot of help, is a nice way to get them up. I find it very useful. And then to go back down, you're just going to, and again, I like to tell people to go onto their shoulder, not their elbow. Because what I find people do, they'll come to their elbow, and then they don't want to get off their elbow. And then it's like, okay, I got to pull it out from underneath them, and then it drops them down. Okay, so come on up. So I like to tell them, we're going to go down onto your shoulder. Okay, so we're going to come on down onto your shoulder, and as you do that, I'm going to help you bring your legs up like that. And again, so you're using that pivot to try to, so you have to practice so you get the sense of, as your body weight goes down, you know when to bring the legs up, and then it's easier. If you do the body, then the legs are going to feel stress. It's not going to be as comfortable. However, have I ever done the body first and then the legs? If they're real tall and their legs are real heavy and there's just no way I can do it and we're stuck, then yes, I'll do that, and then I quickly bring their legs up. Okay, now, so let's say I'm going to get her up from this position, and I'm not going to roll her onto her side. So then I'm going to come up underneath here, and I'm going to get up under your shoulders and up under your legs like this, and I'm going to go ahead and help you up like this. Now, most of our patients have better head control. He's like, if I had a patient with a real floppy head, I would probably need to support her head. But most patients don't do that with their head, unless there's some higher level injury or something. Okay, so and then to get her back down, what you're going to do is you're going to bend and you're going to under there, and then tip and roll down together. So again, you're just taking the weight, and it's the shift and the weight shift, and just kind of getting that balance and practicing that. Okay?
I'm going to add one
Yeah,
thing.
please do.
So you've just seen 2 methods. One is starting from supine up. One is going to sideline first and then up. Think about the biomechanical principles Dr. Brown mentioned in terms of body mechanics. Which one do you think is easier for the therapist generally to do? Which method?
Sideline.
Sideline. Why?
They can get them closer to their body.
Right. Keep the load close. You're closer to, you are getting them closer to you. So the load is closer to you. So it is physically easier for you to do it the sideline way. The other thing about the supine way is therapists could be tempted to want to twist. I think a little bit more. They're way out here and you might get a little more twisting action. So personally, having injured my back a couple times, I rarely would do the supine one simply because I feel like I'm too far away from the patient. And in that one I might get, if I can't roll them sideline, I get a second helper to be behind. So consider the biomechanics. Are you able to do the supine one? Is there a good reason? There are sometimes, but if they roll to the side, they're closer to you.
I noticed this table is really low versus you're saying to keep it, like, was that just? 'cause
Yeah,
you
I
didn't
did
think
that because that's typically where the hospital bed is. You want it when you sit them up. You want them up with their feet on the floor. You usually, even though ideally you want it high for us, when you're getting a patient sitting on the edge of the bed, you want, I don't usually get them up with the bed super high. I might bring it up a little bit higher if I feel like they're not going to freak out about once they sit up. But but a lot of times you want it already down low so that you're going to sit them up and their feet are going to be on the floor. But you can have it elevated if you think. Now there's patients that I know that I'm not going to actually get up and walk, and I just want them to sit on the bench to get that trunk control and the upright posture for breathing and all kinds of other reasons. I might actually have the bed elevated, and then I can be at a little better mechanical advantage for me.
If the bed's elevated, can you use a stool for their feet? If
You
want,
can,
if
you
want.
can, but it's in your way.
Okay.
Typically, because you're right where the stool will go, then you have to move the stool over, and that's okay. You can do that, and there are times. Used to be the hospital, and there still are some intensive care beds. A lot of times don't lower because they have to be up a certain height because they have to be able to fit the X-ray machines underneath, the portable X-ray machines. That's one of the reasons that they don't lower. In our facility now, we have all new beds in the last 2 years throughout the whole facility. Now our intensive care beds go very low. We're very fortunate. But that is not the case in a lot of places, and probably a lot of beds are these beds are probably $30,000 a piece. And you think of a 200 and some, I mean, they're very expensive. So there, you aren't going to find that everywhere. You're going to find beds that you're going to have the little old lady who is 4'7", and you've got to get up for a bed that's this height onto the floor. So that's a unique situation. And then you'll have the bed at the height, and then you're going to have situations where you can get the bed lower. So it just depends on, you have to work with the best case. We're going to, you're not always going to have best case scenario, but that is a good question and a good comment. Okay, does that make sense? Do you guys want to take 1 minute, 2 minutes to practice, or do you observing you want to practice on your own? I just don't want to take too much time. You guys want to practice real quickly? Okay, take 2 minutes, real quick.